Hi, everyone. This is Fran Horning, and I'm here with the Iabdm, the International Academy of Biological Dentistry and Medicine. And I have here some amazing people that have gone through a very rigorous progress of some education. So I'm going to introduce you to them. We have Dr. Yuko Torigoe, who is the owner of Harmony Dental in Boston, Massachusetts. It's a holistic dental center. And I have to tell you, we are so amazed by the fact that she has gotten her entire staff certified in the practice of biological dentistry, which is a feat that is beyond belief. And we are all here at the Academy extremely grateful and extremely happy that we have an office that is fully certified. Doctor prefers to go by Dr. Yuko, so we're going to say, Doctor, if you would just give us a little information. Why did you decide that you wanted to get certified with the Iabdm? And then on top of that, why did you think it was so important that all of your staff were certified?
So, in dental school, we go through traditional study of dentistry, and then our office is biologic and holistic, and it's already hard enough for any staff to learn about dentistry, but on top of that, to learn more about holistic and biologic approach that could be really, really comprehensive, a lot of medical things and some other, practice. And all my staff just learned from just listening to us, listening to our consultation with patients. So I thought it will be much more educational for all of our staff to formally be trained and to learn about what we all talk about. So that's why I wanted all the staff, not just the clinical staff, but when patient contact us, the front staff are mostly the first people in contact, and then patients always ask questions, and sometimes they all have to say, well, you can ask those questions to doctors, but what more way to be able to answer some of the questions from the front staff. So that's one of the reasons I wanted all of them. And then when patients come to the treatment room, I'm not the first people to meet. Usually my assistant escort my patients. So, I just wanted to make sure every staff my patient meets, they're knowledgeable about what we're doing. So
Fabulous.
That's why, we thought it was important for all of us. And then also, again, I have DMD degree, I have bachelor's degree, and then all of my staff, I thought it will be nice to have some sort of this, well acknowledged this certification that's kind of like, hey, I have this, so.
Empowering them. And talking about your staff, I'm going to ask you to please introduce my Brady Bunch over here, so you can tell us who we have.
So I have Julissa, who is my office manager. We call her Juju, and Juju's been with me for many, many years. We've practiced, we worked together in a traditional office, and then when I transitioned to a holistic office, she came along with me. So she's been with me for more than, 12 years or something like that. And then we have Ari, who's our hygienist, and he's currently attending Tufts Dental School. He's a third-year dental student. So he'll be Dr. Ari very soon. And but he's been practicing hygiene for a while. Then he's also been practiced in another holistic office as well. So it was great to have him come to our office. And then last but not least, we have our assistant, Sarah. She is a Reiki master, and she's been able to offer some Reiki, to our patients. So that's my Brady Bunch.
Nice, fabulous, amazing stories. And the fact that somebody who's been with you for so many years and transition from traditional to holistic, and somebody who was already practicing in holistic, and then Sarah, who does Reiki and then found your practice. It's just like, it's amazing how everything just all came together. And I'm just going to circle back to what you said about that you and Julissa were working together in a traditional practice. What made you decide, or what, did something happen, or what decision made you decide to go practice biological and holistic dentistry?
So I'm in my mid-40s, and around early 30s, I started to be more interested in like organic food, more, paying attention to what I'm eating, what kind of products I'm using, even to clean my house and everything. So when I start to pay attention to those, I start to question like, okay, is there a way to do something what I'm practicing my personal life in dentistry? And the information wasn't really there. So fast forward 2014, I was fortunate to work with holistic dentist Dr. Janet Stopka, and she kind of mentored me the whole year when I was working with her, how holistic practice looked like. And that I was just, it's like a love at first sight. I was like, this is meant to be like for me. And then since then, it's like I wish I did this when I graduated from dental school, because it's more fulfilling. And I feel like I have better connection with patient in a different level, deeper level. So that was my kind of decision from transitioning from traditional to holistic.
It's a great story, because there's something that makes us change, something that we either experience or find out that makes us want to make that change. So that's a great story. Now that everybody is certified, how do you guys feel certified? Sarah, I'm going to ask you first. How does it feel to be a certified registered dental assistant?
So I feel super confident, even more confident now speaking to our patients. And I just feel like I can tie everything together a lot more, and everything makes a lot more sense than it did before. Because now I can talk about more than just Reiki, what else is that we do as holistic. So I personally feel more confident.
You feel more empowered. It gives you like you're part of the team, not just a body in the team. That makes you part of the whole process in getting patient well, right? That's fantastic. And Jalisa, I mean, you went from traditional to holistic. How was that transition for you?
It was a lot to take in at first. I have a lot of experience doing this, but just the idea of being able to learn so much more about holistic dentistry, and not only does it benefit me, in the office as well as my personal life. I think it was a great transition. I'm forever grateful to have been able to learn that from Dr. Yuko, and that she introduced me to that in my life altogether. But I feel very empowered having learned everything that I did, being certified. And like Sarah said, I also feel very knowledgeable, so I feel confident in speaking to patients. And I know that if there's any additional questions, we have a lot of really well-educated patients in the office, so it's important for us to be able to counter that education as well, and make them feel comfortable coming to the office, that everyone here has the ability to answer any questions they may have.
Absolutely. The first patient experience that they have is when they call the office. So when they have someone like yourself who's fully certified, and you have the knowledge and you're able to answer their questions, they feel comfortable and they feel welcome. And then they're going to come in and they're going to be able to get the wonderful biological dentistry performed by Dr. Yuko, right? And for the hygiene with almost Dr. Ari, but Ari can perform wonderful biological hygiene. So now, as a hygienist, you were already in a holistic practice. How do you feel being certified now as a biological hygienist?
So I agree with both Julissa and Sarah. I definitely feel more well-informed. I can connect better to the patients, especially when it comes to patient education and, throughout their appointments, starting from, basic oral hygiene practices to other adjunct therapies that either one we can offer, or two different recommendations, and just kind of be more holistic about their overall systemic health and their oral health. And I came from both conventional and holistic background. I did many years in conventional and at the same time holistic, actually. And I kind of got lucky falling into this biologic realm. And that was thank you to Dr. Jerry Curatola as well. And then Dr. Yuko also enhanced my background in holistic dentistry. And now with this certification as well, now I feel way more well-rounded with it and much more comfortable with being able to talk to the patients about specific topics, even relaying certain information to other peers that I'm in dental school with, that, here and there they ask me, what did you learn here? What did you learn there? Or, it's good to be curious, and then it's good to be able to have the information for everyone as well.
Right. Like I said to Sarah, it's very empowering, especially as someone like yourself, as a hygienist, and then, soon to be doctor, having this additional information that people take years to accumulate. And that's wonderful. So I think it's wonderful. So now that you're all certified, actually, how many staff members do you have certified, Dr. Yuko?
Oh, how many? I know it's somewhere between 12 to 15.
Wow, so it's a large office. See that? That is a huge feat. My goodness. That is, I have to say, wow. So we just have a small Brady Bunch today. That's fantastic. Wow. I mean, so now that you have such a good chunk of people certified, like where do you see the future of your practice now?
Also, now the standard is set high because every staff that we're going to have, whether it's a new staff, just I want to make sure that they're all going to go through. This is going to be the protocol that every staff has to go through. So I want to make sure that's going to be the part of, kind of onboarding process for new employees. And I think, again, that gives them confidence too. So not just like, oh, I'm just an assistant or I'm just a front staff, they're certified, front desk, person certified. It's a nice, things to have and be proud of what they do.
Exactly. I agree with you. Now, I'm going to ask everybody, now that you've been practicing this biological world, where do you see biological dentistry possibly going in the future? I'm going to start with you, Sarah.
I see it progressing a lot more. I've already seen it progress in the last year, even with Reiki. I hope to see Reiki in a lot of holistic dental offices. And, instead of using like Valium per se, if a patient is like nervous for a procedure, it's like, just come sit in. I actually turn the lights off. We have like warm neck pillows and essential oils and like a massage chair. So I just like kind of lightly put my hands on them and they're just like so calm and they're so grateful when they leave and they thank me up and down. And it's just like such an amazing feeling to have done that for them and to incorporate that into my day job, because it's like both of my worlds collided and it's just more than I could have honestly ever asked for. So I thank Dr. Yuko so much for this opportunity and for you, of course.
Oh, that is, it feels great at the end of the day that that you're living your purpose, right? And that you've helped people. And It's such an amazing, amazing feeling. And Julissa, and where do you see biological dentistry going now that you started in traditional? We all started in traditional, but you started with her, Dr. Yuko traditionally, now in holistic. Where do you think the world of biological dentistry might be going in the future?
Hard to predict that because there's just going to be so much more advancement. There's so many possibilities, and I think we're going to achieve oral health. We're going to look at where we've come from, and we're just going to keep trying to find new ways to like educate people and, transition more offices into being holistic dentists. Because I feel right now there's only about 2, near Massachusetts, and I think there's another one, I think, in Groton. But, there are many holistic dental offices out there. So I think that the future holds more offices becoming certified, becoming more educated, transitioning into holistic dentistry so that more and more patients could, take advantage of this wonderful opportunity of just being able to take part in this.
I agree with you wholeheartedly. I believe and I hope that more and more will be becoming holistic biological practitioners. And that will we're going to segue right to Ari because he will be soon a holistic doctor, correct? What do you think? What do you see in the future?
It's hard, like Julissa said, it's hard to predict, but I do see it progressing in a positive way. I think as time goes on, more practitioners will be getting these certifications. More patients will be exposed to this kind of world of biologic dentistry. More evidence-based dentistry and medicine around these topics that we cover, within the certification or in the practices that we hold here in the practice. I think there'll be more exposure, and the exposure is the key, and to allow it to progress into the future. But I think it'll eventually blow up. I think I see a lot of like ozone or a lot of other kind of therapies that are used, that it's going to become the future for the most part.
I agree with you. It's a lot of, getting the education out there And, you know, it's all evidence-based science, and more patients are asking for it. They're turning away from the traditional or the allopathic world, and they're turning more to what we do, right? And so, Dr. Yuko, I'm going to give you the last word on what you think the future of your practice and the future of biological dentistry in general.
Well, like everybody said, I think this is the kind of like a positive trend that everybody's asking for, you know, and we are here to serve those patients. And in terms of our office, I think we're just going to keep growing and providing more holistic care. And I'm a firm believer of just keep learning more. So I don't want to just stop here. With the pandemic, it was a very difficult year in terms of my education, because I used to just leave every month or every other month somewhere all over the world to learn more for my patients, you know. And so I'm gonna continue my education, but at the same time, I want my staff to be part of this education, not just this one certification, but if I find more certification, I'm going to be asking my staff, like, look, there's another certification, and, you know, more and more, you know, certification and just education in general is what we all need. And that, I think that's the best thing we can do for our patients, just keep learning and just bettering ourselves. So
Wonderful. Thank you, doctor, because that's the key of having a doctor who wants to empower her staff or his staff to be able to be the best version of themselves so that they can serve more people and help more people. And I'm so glad that the IBDM has a value or a venue that you can do that. You can learn more about how you can help people. And I'm so grateful that you took the time to spend with me this afternoon. I again congratulate you all for such a well done job. Very hard to get it all done, put in. People don't realize the certification is a test, and then you have to do an article or a PowerPoint, and so it's really intensive. But at the end of the day, you're like, wow, that was such a great thing, and I am so glad I did it. And I want to thank you all. And Dr. Yuko, again, thank you and congratulations from the bottom of our hearts for having the full staff certified, the first office in the entire world.
yay!
Never mind nationally, but internationally, to be certified, full staff certified in biological dentistry through the IBDM. Because remember, the IBDM is the OG of biological dentistry. My son's like, please stop saying OG, but it's the original. And the ones that really want to thank you again for all of your hard work, and congratulations, and be well.
Thank you.
Thank you.
Yes, thank you.